Good evening, everyone. My name is Andrew, and this is my social media marketing strategy presentation on the topic of mental health. I hope you find it both enjoyable and informative. Mental health is a growing public health issue that continues to pose a significant burden around the world. Mental health is a topic that often gets overlooked for a variety of reasons, the most common of which is stigma. Many people battling some form of mental health condition often avoid disclosing information about their situation, resulting in a lack of treatment-seeking behaviors. Different mental health conditions are experienced uniquely among diverse demographics. For example, a child's perception of depression is typically not going to be the same as a grown adult's. With this in mind, targeted communication and leadership efforts are essential to effectively spread awareness about mental health conditions, with the hopes of encouraging people to seek treatment. Over the last decade, social media platforms such as Facebook and X have become increasingly popular as a means of disseminating vital information about pretty much anything, and can also be leveraged to help reach a myriad of public health goals. This presentation is tailored as a marketing strategy to utilize different social media platforms to address mental health. To do that, we will be looking at 4 different target audiences and 4 different social media platforms, and incorporate different leadership styles deemed best suited to make the biggest impact in discussing mental health with the public. First, we'll start with teenagers within the age range of 13 to 19. Teenagers represent a unique demographic as the age group that is faced with the early struggles of growing up. There are so many stimuli that teenagers are exposed to, from the internet, evolving relationship dynamics, and hormonal changes, just to name a few, making them a very critical target to dive into mental health education and campaign for improved awareness. This can be done utilizing the platform TikTok, which is currently one of the most popular outlets for younger demographics. It is a user-friendly ecosystem that often capitalizes on popular cultural references to generate content. This helps keep the content relevant to teens, and it makes it more likely to keep them engaged with what they are seeing. With this in mind, we can incorporate education and awareness aimed at empowering teens who may find themselves struggling with a mental health condition. Generating videos intended to highlight the human element of mental health conditions and demonstrating that teens are not alone can help them acknowledge and address their battles. To bolster this, partnerships with popular social media influencers, celebrities, and health professionals who are genuinely passionate about promoting mental health can also help resonate with teens and get the necessary messages across. Sharing mental health journeys, coping mechanisms, challenges, and victories can be the key to helping teens gain a better understanding of the things that might be taxing their mental health, and could also encourage them to seek assistance and, if necessary, medical treatment. Young adults ages 20 to 35 are the next target for this education campaign, as the group that is typically faced with more complex challenges of life. Most individuals within this age range are likely working to support themselves and their families, pursuing higher education, and ultimately seeking to carve out a life of their own. All pretty stressful stuff. The platform X, founded and formerly known as Twitter, is widely utilized by this demographic. X is considered a major hub for a variety of content, some of which makes it here before the story can even hit something like a major mainstream news program. This encourages young adults to be on the lookout for the latest information about many things, making X an ideal place for discussions about mental health. Additionally, X is where the hashtag originated from, which in a way pays homage to a powerful resource that helps users find the content they are looking for with a catchy, creative tagline or slogan. X can be used to create and highlight a vision aimed at minimizing and ultimately doing away with the stigma associated with mental health conditions. Posting concise, powerful messages meant to inspire online communities to promote self-care and prioritize mental health among young adults can aid in delivering important messages and create a culture of breaking mental health stigmas. Asking questions that are meant to engage young adults in discussions and let them get a feel for what coping techniques might be out there that can potentially provide similar benefits to them. It's important to let people share their experiences to the extent that they feel comfortable, without fear of being ridiculed or outcasted. Using a platform like X to perpetuate mental health content can serve as a powerful asset in catalyzing conversations about mental health among young adults who may be experiencing similar struggles, in the hopes of making it a topic that is less taboo and providing more context and community-driven solutions. For the next target audience, we have parents. Parents are a unique demographic for this topic since they are faced with a double-edged sword. They are burdened with the reality of watching their children struggle with mental health issues, which in turn can potentially manifest into mental health conditions of their own. This makes it imperative to provide critical mental health education and awareness for parents to really guide them in helping their kids and indirectly helping themselves. This can be done using Facebook, a tried and true social media platform that is still a favorite among older age demographics. Facebook has evolved greatly since it first launched, and has become a comprehensive platform for a wide variety of functions from news, event coordination, and for purposes of this presentation, a place for online forums and groups. Facebook can be used to foster collaboration among other parents, mental health experts, and professional organizations to create a place for parents to safely learn from one another and communicate ideas. Facebook can also be used to publish and promote events for parents for purposes of discussing adolescent mental health, and can even be a platform to broadcast live events for people to watch in the convenience of their own homes. Through shared discussion and establishing a place to come together as parents, Facebook can be a vital outlet for mental health education and communication to provide parents with the support and the tools to be more vigilant and play a more active role in managing mental health struggles experienced by their children. For our last target audience, we have healthcare workers. When it comes to mental health, healthcare workers are sometimes left out of the conversation. For all the hard work and trauma that first responders often deal with during medical emergencies, their mental well-being sometimes falls through the cracks. The topic of burnout is becoming more of a mainstream discussion within the realm of public health, but it is important that the conversation never loses traction. As a more professional social media platform, LinkedIn is a suitable outlet for communicating mental health education to healthcare workers. LinkedIn is focused around workers and is a hub for recruitment, sharing workplace experiences, and providing resources for workers of all industries. It is a very easy place to engage with healthcare workers and collaborate with professional communities to discuss and promote tactics for improving mental health. Polls and surveys can be used to gauge the most common barriers to addressing mental health among healthcare workers. Like most social media platforms, sharing content like scholarly articles and posts from healthcare professionals is a very common practice on LinkedIn, making it seamless to push mental health resources to healthcare workers. Lastly, given the employee-centric nature of LinkedIn, healthcare and human resources professionals are quite abundant for general workplace education, making collaborating with them a vital resource to cater to the mental health needs of healthcare workers. To conclude, mental health education and awareness are vital in encouraging people to acknowledge their challenges and ultimately seek assistance. Leveraging social media platforms has the potential to reach a significant portion of the population very rapidly, ensuring that important information reaches the most amount of people. Targeted outreach efforts tailored to unique demographics and carefully selected leadership styles are essential considerations to make the greatest impact on those struggling with mental health conditions. With this, it is essential to acknowledge that information has the potential to be miscommunicated, resulting in misinformation being spread to the population. All messaging should be supported by transparent, credible, and factual data wherever appropriate to ensure we can always communicate resources for support, solutions, and respectful discussion. Thank you for tuning into my presentation, everybody. Hope you enjoyed, and here are my references.